Just to say thank you for your, outline draft submission of what you're about to send out to your communities that you support as part of your cooperative. Just to say it made my heart swell to see those words and that ethos, which is very much similar to our own. So just to acknowledge it, really, it's just really lovely to see, and I wish that was happening everywhere. Just one of the other documents on there is around our pandemic response. Mm-hmm. I think it's titled Pandemic Response. It's a similar PDF on the same web page. But I was just thinking, just when I was reading what you'd written, how do you create the kind of networks of support in a place? Which is kind of the aspiration, isn't it, really? Mm-hmm. And involving the people in that. And so we're now, because I think I might have mentioned it when we met with others, but we've got this thing now called the Community Helpline. Okay. The community builders who do the ABCD stuff are an integral part of that Community Helpline. But it evolved in the pandemic because we were working with lots of older people and we knew a lot of them, wouldn't be able to engage in 111 websites and all this, and you couldn't get through to 111 anyway.
Yeah.
And so lots of people bubbled up with what they call mutual self-help or mutual aid. I think people love jargon, don't they? But so in Torbay, what happened is we set something up via a helpline and then loads of other people joined it. So what we've now got is we've got residents taking calls. Okay. You might call them volunteers, but we just call them people, really. So they take the calls in their own homes. Mm-hmm. We provide them with the infrastructure and the guidance and the training. They just capture the information, but they do it in a friendly way because it's another human. It's not like a scripted call center. Mm-hmm. And so we've got, I could show you some of the forms. I mean, they're really quite sophisticated now, with all the things that people are asking for.
Okay.
So it was about meeting need in the pandemic originally, whether it's dog walking, prescriptions, shopping. But as it evolved, the requests that were coming in started to grow out. Mm-hmm. Benefits, housing, mental health, bereavement, and I could go on and on and on. Mm-hmm. And then what happened, and none of this was planned, it just sort of happened for us. So then social care were looking at all of this, because it was across the whole of Torbay, the unitary authority of 3 towns. They said, this is amazing. Everyone saw, this kind of community and voluntary response to the pandemic. Mm-hmm. So now it's the front door for social care in Torbay. Oh, wow. So we're leading it with lots of other charities and community groups, and most importantly, lots of residents doing stuff for each other. And now they've funded it. So okay. we haven't quite sorted out the tech bit yet. So at the moment, they divert calls from their telephony system to ours. We then pick them up as a social care inquiry. We then do all the things that we would normally do, all the things I just mentioned. Mm-hmm. And they've funded extra capacity to have then a sort of, we're calling it triage, don't ask me why, it's sort of medical terminology, but anyway.
It's like
we've got like a dedicated person now we just recruited who triages people into social care. So instead of what happened before was people would phone up social care, about 70% of those people wouldn't get anything other than being referred to an out-of-date directory probably.
Yeah.
Now what they get is they get a friendly person, Mavis from number 69 on the phone. Hello, how can I help? Blah, blah, blah. Takes down all their information. What is it that you need help with? And she might have multiple things, including those things, dog walking. Can someone get my shopping for me because I've hurt my leg, or all of that business. And so social care see it as a way of actually improving access to support, but also reducing demand on very strained social care resource.
Yeah.
And the other thing and I don't know how progressive your social care people are, because they must be funding you as part of what you're doing already, aren't they? So you've already got a relationship with these folk. The thing I love about it is that the strapline is one call, that's all. Okay. So there's no signposting. Yeah, you call up a friendly helpline. staffed by a resident in their own front room using their own Wi-Fi with their own laptop or tablet. We just provide the tech on the software that goes on it to make it work. So it's really low cost. And of course, it's all on one CRM system. We've got then a range of partners. So all the advice agencies in the voluntary sector are linked into this and are triaged through one of them. So if you phone up and say, well, actually, I've got a problem with my fuel and I've got a problem with other benefits or PIP or whatever it is, that gets routed via an advice agency who know what all that means to the relevant other advice agencies. And then they contact the person. Because what we've heard when we've engaged with people multiple times around multiple things is people say, I get passed from here to here to here to here. I don't fit this criteria. I don't fit that threshold. It's really frustrating, isn't it? And most people access social care at a point of crisis. And it's in a world they don't have no understanding about because it's not a transparent thing, is it? No. So people then have got to try and navigate the whole mess of health and social care and where do I go for this and that? And it's just like at the time when you're dealing with some really major family stress stuff around care. So I just wanted to say, just thinking in terms of evolution, I mean, what people might say, and they often do say, don't they, is actually, I wish I knew where to go to get what I need. And the problem is it's so complicated. What we've done is create this new step in all of that, which means you don't have to navigate it. We don't, because before we had projects around navigating health and care because it's so complicated. So now
they call that.
You call one number, all the details on the system. We do the consent around. We need to pass on your information to our range of wider partners to meet your need. Yes, we're happy. And then because it's on this cloud-based CRM system, all the other bits then run their reports the next morning. See, oh yes, I've got an urgent one because it's all done around urgency as well. Immediate, I've run out of food, I've got nothing in the fridge, need something tomorrow, all this sort of business. And then they pick up that and then triage it on to the relevant. And but in that call, because on the forms, we've got a whole list of requests or needs and a whole list of contributions and offers. So in that conversation, we always ask the individual whether there's anything they would like to contribute. So what we do is our community workers then match up requests and offers where it's practical community support. So the reason I'm mentioning it to you, I mean, you don't have to something quite as sophisticated as all of this, and it's a smaller area, I think, isn't it? But you've already got a contact point, haven't you? You've got an inquiry line. Just thinking about that involvement and cooperative ethos of the people. What we found time and time again is people want to feel valued and purposeful. So a lot of the people who are struggling are the people that are on our phone lines or who are delivering befriending over the telephone or who are, providing practical support and delivering food parcels. They're doing it in our area within the vaccination centres as well. So, and I talk to these people and they're so proud to be involved and to be valued and to be contributing. And all of that is part of this ethos. So I just thought I'd mention it because you're involved with social care. That it's not just the connection and networks in community. There's something beyond that could be explored